Good morning, everybody. First and foremost, I want to say thank you for attending this portion of training. My name is Stephen Baez. I am a sergeant with the Addison Police Department. I've been with the department for 20 years. For this block of instruction, we're going to be discussing autism and our law enforcement approach. Some of you are kind of wondering, well, why are we talking about autism? Why is it so important for us to understand autism? And we'll talk about that. But we are aware of several incidents that occurred across the country, whether it's Buckeye, Arizona, more recently in Salt Lake City, and where interactions with an individual with autism and law enforcement has gone horribly, horribly wrong. For me, this is personal. In 2013, my two youngest sons were diagnosed with autism. And after receiving this life-altering diagnosis of that my sons will have for the rest of their lives, my wife and I set out on a mission to become autism advocates. So we set out and we learned everything we possibly could about autism so that we could better be advocates for our sons as they got older. As I began to learn more, I began to wonder, are we as law enforcement really prepared to interact with somebody who has autism? And I began to think, if my two worlds collided, i.e. my professional life and my personal life met, how would this interaction go? And I looked into it more and realized that there was very little resources out there for law enforcement agencies on understanding what autism it is and different approaches to how to interact with these individuals when eventually we will have contact with them. Okay. The rising numbers of autism diagnosis in this country, it's not a matter of if you're going to have contact with somebody with autism, but it is when. So I'm going to start you out with a letter that my department received a few years ago. This was directed to my chief of police, and it was sent by a citizen who lived in our town. Okay. And in summary, the email that was sent to my chief basically voices the concerns of a parent of a son who has autism. Okay. And he was concerned about how we as a police department would interact with his son if we had contact with him. Okay. During my time in my career, I spent 3 years as a school resource officer in our elementary school district. And I was assigned primarily to the junior high, where this student, where this father who sent this email, his son was a student of mine. So I was familiar with his son. So my chief, and I love him and I respect him to the utmost, asked me to reach back out to this father and kind of explain some of the programs that we're doing within our department, which as we get farther in today, we will discuss at length. But this email was really my motivation to say, we can begin to do more as law enforcement agencies. We can begin to learn the characteristics of autism. We can begin to recognize the characteristics of autism and some of the behaviors that we will demonstrate, that we will see, that they will demonstrate upon having interaction with us as law enforcement. So it is really the goal of today in this training is for us to have a better understanding of what autism is and develop some safe strategies for interaction, how to communicate, how to de-escalate, as well as initiating some programs within our agencies that will help us better serve our special needs community. Okay. Here's my disclaimer though. No one expects us to, as law enforcement, to diagnose autism, okay? Most of us don't have medical degrees or are not psychiatrists or psychologists. So I'm not asking you to go out and diagnose it, but there are some signs and characteristics that you will be able to identify on a call for service or in the field, okay? And we can prevent some of these tragic incidents that we've seen from occurring if possible. Okay? So we'll get into it. What is autism, okay? The root word of autism is Greek, and it means alone. So it's a state of being alone or cut off. And that it really is a great way to describe autism. Individuals with autism, children and both adults, individuals with autism, adults and children, are kind of said to interact within their own little world. Okay, the world kind of operates around them, but they're not necessarily involved with it. It's a great way to describe it. Autism is a complex neurodevelopmental disorder that has no known cure and no known cause. There are a lot of theories of why autism occurs and what the cause of it is. We know for a fact there is a genetic component to autism, because the likelihood if you have one child with autism, the likelihood that you will have a second is about 80%. And that is my case. I have an 11-year-old and a 9-year-old. Both have autism diagnosis. We'll get into it a little bit, the differences between the two of them, because they have the same diagnosis, but they are very different in some of their characteristics and behaviors. Autism is part of a larger group of disorders known as Autism Spectrum Disorders, or ASD. And you'll hear me throughout the morning or this presentation talk about ASD. And I'm referring to Autism Spectrum Disorders because they call it a spectrum, because the autism family is huge. You can lie anywhere in the spectrum, from higher functioning to lower functioning, or anywhere in the middle. And there's a saying out there that says, if you know one person with autism, well, guess what? You probably know one person with autism, because everybody's going to be a little bit different. Autism affects normal brain development in 3 areas: social interaction, communication, repetitive behaviors, and difficulty adjusting to change. Those are the main characteristics that are affected with autism. Here is the other disclaimer. Those are key components that we use as law enforcement to do our job, okay? Our ability to communicate with people, okay? The ability to look at somebody and understand why their behaviors are being unique or stand out among someone else. A difficulty in adjusting to change. Those are all characteristics. These are all things that we use to do our job as law enforcement, okay? There's certain things that we are taught from day one in the police academy to look for, okay? When we interact with somebody socially, we call out to them. Are they going to have eye contact with us? If they don't, we automatically feel that they're being evasive, they're being uncooperative, they're hiding something. Okay. Now we need to understand that that's part of an autism characteristics that could be affecting what this individual is, why this individual is not interacting with us. Okay. What is autism? Autism can be reliably diagnosed by the age of 2. And here it is. In my case, in my family, my middle son, who's now 11, we started to see some key factors or key things that kind of gave us some red flags that there might be something going on. My wife, her little mommy senses went off and immediately said that she noticed that something was different with Zach. Me, on the other hand, I was a little bit of denial, and I felt that, no, he will catch up, and it's not a big deal. As Zach began to progress, we saw that things weren't changing. Okay. Fast forward a little bit further, my youngest son, Andrew, was born, and we began to see the same characteristics with him that we saw with Zach. So Zach was diagnosed at the age of 4, and my youngest son, Andrew, was diagnosed at the age of 2. But we started to see these things with Andrew a little bit earlier, so we were able to get him diagnosed earlier. Currently, there is no singular proven cause for autism. There's a lot of different theories. We know, like I said, there's a genetic component. The theory that vaccines are the cause of autism has been debunked. The doctor who actually put that study out had his medical license revoked and had to retract his statement. The autism vaccine link occurs because the characteristics of autism start to manifest themselves about the same time that our kids will be getting their vaccines. So those milestones we look for our children, whether walking, talking, those milestones we're looking for happen to coincide with the same time that they were beginning their rounds of vaccines. So the connection was always assumed that vaccines were the cause of autism. That is not an accurate cause of autism. Okay. Autism is a lifelong diagnosis, but autism is treatable. It's usually done through intensive therapies, whether it's occupational therapy, behavior therapy, speech therapy, physical therapy. And there are some medicinal things that can be used to kind of overcome some of the characteristics of autism. Okay. So individuals with autism may have unusual responses to sensory experiences, such as sounds, the way an object looks, smells, light, things like that. The individual with autism can be hypersensitive, meaning overly sensitive to a certain stimulus, or hyposensitive, meaning undersensitive to a certain stimulus. Hyposensitive sensitivity would be that of pain. That becomes a problem with us in law enforcement, right? A lot of and use of force considerations, we utilize pain compliance to get somebody to comply with what we want. In a case with an individual with autism, that pain compliance is probably not going to be effective. Just a thought. Autism is considered a hidden disability, meaning this: you cannot look at someone with autism and say, yep, there are some physical characteristics that I can see that said, yep, this person is absolutely on the autism spectrum. That is not accurate. So they call it a hidden disability, in that you can't look at somebody and say, yes, this person has it. Some other disabilities like Down syndrome, there are some physical characteristics associated with it that you can physically see. Autism does not have that, okay? And symptoms of autism can range from mild to severe. So low functioning, moderate functioning, or higher functioning. And you can fall anywhere in the middle of this, depending on on the diagnosis and the severity of the autism. Higher functioning individuals with autism can hold jobs, get married, have children. Some of the greatest minds in this world are rumored to have an autism diagnosis. Autism necessarily doesn't affect someone's IQ, although it can. Okay? Autism spectrum disorders are kind of divided into certain categories, and that is these. Autistic disorder, which is the most severe form of autism. These individuals with this diagnosis will need probably support for the remainder of their lives. There is a milder form of autism called Asperger's syndrome, although they are getting away from that terminology, but Asperger's is considered the higher functioning form of autism. Individuals with Asperger's can work, drive, hold jobs, have families, things like that. Okay. Then there is pervasive developmental disorder not otherwise specified, that is PDD-NOS, and that means there is some characteristics of autism being demonstrated, but not all of them, so they lump you into the autism category. Okay. Rett syndrome is only found in females and represents a severe form of autism. And childhood disintegrative disorder resembles symptoms of Rett, but can include the male population. In this instance, children progress normally up until a certain point, and then it just suddenly just stops. And all progress that has been made is now lost. There is no really explanation or scientific reasoning why this happens, but there are numerous families that have had this experience where their child has progressed normally, and then at a certain age, it just stops cold. Okay. In addition to this, about 3/4 of the population with autism suffer from additional conditions or a comorbid condition. These can include anxiety, ADHD, Fragile X, which is a genetic disorder, depression, gastrointestinal issues, obsessive compulsive disorders, seizures, Tourette syndrome, and intellectual disability, sleep issues, and motor difficulties. So in conjunction with an autism diagnosis, a significant portion of the autism population has an additional condition on top of their diagnosis. So in my family's case, both my sons have an anxiety diagnosis, and my youngest son has an ADHD diagnosis on top of his autism diagnosis. Okay. My middle son, Zach, has a borderline intellectual disability as well on top of his autism diagnosis. So it's not uncommon to have multiple conditions associated with an autism diagnosis. Okay. There are some physical complications associated with autism, and that is 40% of the autism population will suffer from seizures. They're also hypotonic, where they have low muscle tone. And that is meaning that their trunk muscles are undeveloped. That can lead to difficulties in breathing while under stress, in a prone position, or physically weak or unsteady. And then asthma and heart conditions are also very common with an autism diagnosis. Why is this important? When we're talking about this, why is this so important? Because during a confrontation or an interaction with law enforcement, if there is a use of force incident, people with autism are at significantly more risk for positional asphyxia than that of the average person. So it's essential that if you have a use of force situation where the person is face down, we need to get them up immediately. Okay. After that interaction, because of the propensity or the probability that they have a seizures, it's important that we understand that adrenaline dump or an interaction when it's stressful could trigger a seizure. So it's important to understand some of the physical characteristics or physical complications associated with autism. Okay, here are some of the current statistics. ASD occurs in all racial, ethnic, and economic social groups. Okay, in 2020, these are brand new numbers that came out in May. Centers for Disease Control report that 1 in 54 births will have an autism diagnosis. Okay, it's a little deceiving. Okay, and how this works with the CDC is they take birth to the age of 8, and they look for the children in there that have the diagnosis. So when they take these numbers, they're looking at children from birth through age 8. Okay, these numbers are a little deceiving because what happens is children that get diagnosed later in life or adults that get diagnosed aren't really included in this number. So that's a little deceiving. Okay, but I will tell you, in 2018 it was 1 in 59. 2016 it was 1 in 68. If we go back almost 10 years ago, it was 1 in 88. So we're seeing that the numbers are increasing every couple of years, these staggering rates. Okay? Autism is 4 times more common in the male population than it is in the female population. So it's 1 in 34 boys or 1 in 400 girls will be have an autism diagnosis. About 31% of the children with Este have an intellectual disability on top of the autism diagnosis, and that is my middle son. He has a borderline intellectual disability as well. About half the children identified with autism have an average to above average intellectual disability. So we're knowing that almost half of the people with an autism diagnosis have an average or above average intellectual ability. That's great. It's important to understand that autism will not necessarily always affect that IQ. Okay, it's autism's effects on the communication, the social, and to be able to communicate does not mean the person does not have the intellectual ability to perform certain things. It's just the characteristics or the deficits with autism are the ones that kind of hold them back. About 35% of the adults ages 19 to 23 with autism have never had a job or received a postgraduate education after leaving high school. This is important because what happens as these children with all these 1 in 54 children grow into adulthood, what's going to happen? If there's no resources for them, there's no further education, there's no job opportunities, what is going to happen is they're going to be pushed out into society. And ultimately what is going to happen is they are going to have contact with us as law enforcement. And this is why this training is critical. We want these interactions with these individuals to be positive, and have the resources to be able to interact with them successfully. Okay. Autism, we'll talk about these 3 major areas. We're going to talk about communication difficulties, repetitive and restrictive behaviors, and social impairments. And these are the 3 major areas that affect autism. And they're also the 3 areas that are critical for us to understand so that we can have these successful interactions with people with autism. We will kind of go down and break down each of these, talk about some of the deficiencies and how to overcome some of these issues during these interactions. Okay. Social interaction. So with social interaction, one of the big key components of autism is there will be a reduced eye contact. Not all individuals will have this, but a lot will. The reasoning behind this is our facial features have a lot of things going on. Okay, and it's difficult for a person to focus on that as well as understand what is being said to them. Okay, so it's not that they don't want to have eye contact, but it's difficult for them to maintain eye contact and concentrate what is being said at the same time. So a lot of individuals with autism will have that reduced eye contact. Okay, there's a difficulty in receiving and expressing emotions. So it is said that people with autism have this flat affect face, meaning they don't really show their emotion, they don't really show they're happy, they don't really show that they're sad. Okay, there's difficulty in developing relationships. We know that autism affects someone's ability to interact socially and then to communicate. It's not that they don't want to develop relationships. They want to. It's just very difficult for them to do that. Okay, there's a difficulty in using nonverbal social communication, and we know that most of our communication as people is nonverbal. It's through our body language, our facial features, things like that. If you have a difficult time understanding that, it makes communication and developing relationships very, very difficult. Some of the other components of that social interaction is no respect for personal space. That becomes a major issue for us as law enforcement because we don't want people to get into our personal space. We have this boundary with our level of comfort, and it can easily be invaded in by a person with autism. It's important for us to understand that if we have that information ahead of time, we know they're not really going to be a threat to us as law enforcement, but they may get very, very close to us. Okay, they may not like to be touched. Okay, We talked about those first couple of slides, that hypersensitivity to pain or hyposensitivity to pain. And people with autism, they might like to be touched because the slightest touch may be very painful to them because of that hypersensitivity. Okay. But in essence, you may give them a big bear hug and it may be the most comforting thing they've ever experienced. Okay. It's important to understand that if in a certain circumstance or situation where we have to go hands-on or touch somebody with autism, it's critical that we give them a warning. Listen, I'm going to touch your arm. Give them a chance to respond. They may say, no, I need 1 more minute, or no, I'm not ready. Respect their request, and the interaction will go a lot better. There's a lack of interest in others. And I kind of said this, that my kids always played around other kids, but not necessarily with other kids because of their diagnosis. And that's probably a lot of the difficulties, not that they don't want to, but they have a very difficult time looking at the interests of others. Okay. And the last part of this is no understanding of consequences. This is a difficult thing for us as law enforcement, because what do? If someone doesn't comply with something we say or one of our requests, what happens? There are usually some kind of consequences, whether it's a use of force situation or not. But we knowing if somebody doesn't comply with our commands, there are consequences of what will happen, whether it becomes an arrest. We take a little more action with it, understanding of that. So in a situation where we have a use of force situation where we draw a taser, they are not going to understand what the taser can and will happen if they don't comply with what we're doing. So the understanding of consequences is a very difficult thing. This plays a significant role in the safety of individuals with autism as well. And we'll talk about, as we progress a little bit farther into today, we will talk about those consequences and that heightened sense or a lack of sense of danger. And this goes hand in hand with that no understanding of consequences. Okay. Important for us to understand is what is behavior. And behavior is the way we react to a particular situation and to a stimulus. Okay. Because of the characteristics of autism, some of these behaviors are going to be a little bit different in reaction to certain stimuluses. Right? But it's important for us to understand what the 4 functions of behavior is. This is critical because it will allow us to understand what actions are being done, why they're being done, and how to de-escalate them or have these actions be appropriate. So the functions of behavior, number 1 is attention. And we know that part of our behaviors are we're looking to seek attention for somebody, from an individual or whatever it might be. The next person is escape. And they may be trying to escape an overwhelming or an overstimulation of a particular area. Okay. The next part of our behavior is tangible. Is obviously we want something. We want something, we can't get it, or we're trying to get out of it. And the last part is physical or sensory, and that is our physical needs that we are looking for. These are the motivating factors behind behavior. This is critical to understand as we progress farther into today, and we'll see how this intertwines with some of the things we're going to talk about and the responses to certain stimuli for people with autism. Restrictive and repetitive behaviors. So people with autism have very stereotyped restrictive mannerisms. That could be hand flapping, it could be humming, it could be things, and we'll talk about that in a second. It's a term called stimming or self-stimulating behavior. Okay, there's inflexible adherence to routines. They are very rigid in schedules and the way things happen. That poses a large problem for us as law enforcement, right? Because people don't call us on a regular basis for something that is good. We're not part of a routine. So when we arrive, we are not part of the routine that they are accustomed to. So just our arrival, the presence of us in uniform could be a trigger for us because we are not part of that routine. There are significant restricted interests with people with autism. This can be a very beneficial thing for us because if we know what that restricted interest is, that can be our hook, our way to start to build rapport with this individual. So for my middle son, he's obsessed with commercial airplanes. And my mother-in-law lives very close to O'Hare Airport, so he will sit in her driveway for hours and watch the airplanes go over. He's able to identify every airplane and every carrier as it flies over. If you're during this interaction, they begin talking about something like this, just by engaging or showing interest in that restrictive interest will help you build rapport and help build that relationship during an interaction, okay? There's also a preoccupation with inanimate objects, and this is critical as well, because here's the thing. what do we do as cops? Somebody has something in their hands, and what do we say? Put that down. Let me see your hands. Well, here's the thing: that preoccupation, that inanimate object, may be an item that they're using to calm themselves. So, if that inanimate object is not going to harm us, let them keep it. Do not try to remove that item from them if it's possible. It could be a string, it could be a toy, it could be whatever it is. If it's not interfering with our interaction, let them keep it. By removing that interaction, you're already going to escalate them. Okay. Obsessive compulsive behaviors. So we know that OCD or obsessive compulsive behaviors with autism are very common. Okay, and this can be the inability to vary from a set schedule. It could be refusal to shift from new topics during a conversation, devoting hours to mastering skills and knowledge. And this is my middle son. Just not that long ago, I was listening to him, and he began reciting different things, and I couldn't quite understand what it was. And then I realized that as time passed on, is he had memorized the counties in Texas in alphabetical order. Began watching a video that talked about it, and he memorized the counties in Texas. It's like over 200 counties in the state of Texas, but yet he memorized them in alphabetical order. Again, it's that obsessive compulsive behavior. It's that restricted interest that allows them the ability to master these skills over hours and devoting into it. Again, if we understand what that knowledge is or that restricted interest, it's a great way to build rapport. The last part is strict adherence to rules. And this can be a very beneficial thing for us as law enforcement, right? Because we thrive on rules. So during an interaction, be like, the rules say you have to walk with me. The rules say you have to sit down. The rules say you have to talk to me. That will to build a little bit of rapport because they are very rule-centered. My middle son is like this, and they call him the sheriff at his school because he's the first one to call his fellow students for not following the rules because he is very rule-driven, okay? And the last thing is obsessing, alphabetizing, stacking, rearranging, or lining up items. And this is an obsessive, and it's another one of those restrictive interests associated with autism, okay? So these are some of the pictures. These are pictures from my house. And the one with the toy figures in the gymnasium, we had a meeting at our son's school. And what happened is he brought his toys. When I peeked around the side after the meeting, this is how he had his toys lined up in the middle of the gymnasium. This is my other son, my youngest son, and he's obsessed with these cutouts of shapes and different things like that. They are his most prized possessions. I have boxes and bags of these all over my house. And this one was just from the other day. This is a numbers puzzle, but I turned around and it was lined up along the middle of my living room floor. If you walk into a house and you see things positioned like this in the house, our goal is really not to mess with them if we don't have to, okay? They will become very upset if you interfere with those items because they are lined up or stacked in a particular order for a particular reason. So if you see things like this within a residence, as you respond, please do not interfere with it. It's a great way to build rapport as well because you can ask them about their items. Okay. We talked about it with those restrictive behaviors or restrictive movements, and this is what we call stimming, and this is kind of what I talked about. And stimming is a self-stimulating behavior. And really, stimming is a very critical thing of recognizing the symptoms of autism. And there was a video from 2017 in which an officer is interacting with an individual named Connor, and Connor is walking through a park in Buckeye, Arizona. Connor is walking with a string in his hand, and he's doing this hand with his unique characteristics with a piece of string that is in his hand. The officer, who's a DRE, thinks these behaviors are suspicious and approaches Connor. The interaction goes very, very bad, and Connor receives some injuries due to the interaction with the officer, okay? During that interaction, Connor's caregiver kind of comes up and says, oh, he's stimming, and the officer says, I don't know what that is. Well, that's a major problem because we need to really recognize what stimming is and how important it is. Okay, so stimming can be visual. So it'd be staring at lights, repetitive blinking, moving of fingers in front of your eyes, or hand flapping. It could be auditory, where it's tapping of ears, snapping of fingers, making vocal sounds, or humming. Okay, tactile could be rubbing the skin of one's hands on another object, so carpeting or something soft or something rough. It could be vestibular, or sense of balance. So we'll see rocking back and forth or side to side. And it can be taste, placing body parts or objects in one's mouth or licking of objects. A common disorder with people with autism is the term pica, and it's the eating of inanimate objects. My younger son has a very big oral fixation where he's always chewing on something, whether it be a phone cord or a toy or whatever it is he can get a hold of. A lot of those things end up in his mouth, even at the age of 9 still. So it's not uncommon for an individual with autism, especially to have this part of stimming, to have a chew tube or some kind of chewing thing to kind of overcome that drive or that sensory input that they're looking for. The last one could be smell. So it could be the smelling of objects or sniffing of people. A common characteristic that we can, because smell, we have to realize that people with autism, their sights are very, very heightened. It includes the sense of smell. So this could be very relaxing to them, and they could be seeking input to overcome that heightened sense of smell. Okay. Because of this hypersensitivity, there is a significant sensitivity to light, to sound, and sensitivity to touch. So rooms or items that are very bright can be overstimulating, can be sensitive to sound. And that is my youngest son. He is very overly sensitive to sounds. So it's not uncommon to see children and or adults with noise canceling headphones to kind of block out some of that sound. And then obviously there's the sensitivity to touch that we talked about. It's that heightened sense of pain that can be associated with a touch. So those could be all things that could trigger some negative behaviors associated with somebody with autism. Okay. So signs of overstimulation. So we respond to a call for service, and we know that this individual may be on the autism spectrum. There are some signs that we have to recognize that can be signs of overstimulation. And that could be hand flapping, that can be pacing, that can be rocking, because we know these are forms of what? Stimming, them trying to calm their own bodies. It could be scripting and or loud verbalizations. And scripting is just the rehearsing or the reciting of particular phrases from movies or books that could help them overcome a certain situation. Scripting may have a significant meaning behind it because they may not have the vocabulary to explain what is going on, but the script may be pertinent to the situation that they are in. So it's critical that we have to listen to what is being scripted. But on the second hand, it could be very disassociated, where it has nothing to do with the given situation. But either way, it's still critical for us to understand or listen to what they're scripting. It could be describing what they're going through in a certain situation. Okay. That overstimulation can lead to aggressive behavior. It can lead to a meltdown. Could lead to self-injurious behavior, and it can lead to elopement or wandering from a particular situation. A lot of what we see with problem behaviors or negative behaviors with people with autism is a result of being overstimulated. Crowded areas, too light, too loud, a certain smell, whatever it is, can trigger these negative behaviors that we're seeing. Okay. And I talked about meltdown, but what really is a meltdown? And here is the differences. And for all of us, for our parents, we're sitting in this morning, we understand what a tantrum is. All of our kids, I'm sure, I went through it. We know that a tantrum is want-directed, meaning they want something, they're not getting it, and as a result, the tantrum is. With a meltdown associated with autism, it's a sign of being overstressed. Okay, we know tantrums are goal-driven, so their ultimate goal is to get what they want. We're not giving in as a parent. So that triggers the tantrum. The meltdown with autism, it's a reactive response, meaning there is an overstimulation or something else is going on, and the reaction to that situation is this meltdown. Okay, we know that a tantrum is tantrum seeking with children, and for all of us who are parents, when our child had a tantrum, we would walk away, and what would happen? The tantrum would stop, and what we would do, our kid would stand up, peek around the corner, see where we're at, and once they realized that we're paying attention again, the tantrum would once again begin. With a meltdown with autism, it's continuous without intention. A meltdown with autism can last an extended period of time. It may last an hour to 2 hours, depending on the situation. Okay. We know the tantrums are not injurious, meaning the kids aren't really trying to hurt themselves. They may throw themselves on the floor, but there is really no intention to harm themselves. With a meltdown associated with autism, safety may be compromised because they're not really particular on where this is going to happen, if the environment is safe to do so. So we know that safety may be compromised. With a tantrum, it usually resolves when the goal is accomplished. Honestly, we cave in as parents and we give them what they're looking for. With a meltdown with autism, it may require some assistance to gain control, meaning may have to intervene with some calming strategies to help them de-escalate. Okay, we know tantrums occur with children from about the ages of 1 to 5, but a meltdown associated with autism will last through adulthood. So it can be children, young adults, or even adults. The meltdowns may be a little bit different, but again, they're all associated with autism characteristics. And again, we know it's usually a result of being overstressed and a reaction to a particular situation. Okay. And the stages of a meltdown, and this is kind of how a meltdown works. Okay. So there's those pre-meltdown signs, and this is where intervention is critical. So with my sons, I can read their body language right away, and I know when they're overstimulated or there's something going on, and I can see the signs of when we are on the path to a meltdown. And this is where intervention is critical. Here is the problem. As law enforcement, we're not getting called at this pre-crisis intervention stage, right? We're not getting called at the pre-meltdown stage. We're getting called in at the next stage, and that is our rage stage. It's an explosive loss of behavioral control. And at this point, safety is our main concern. There is no negotiating. There is no rationalization during this. What it really happens to do is we have to reduce that overstimulation and try to utilize some of those calming strategies. And the biggest thing is time. And again, I kind of said it in the last line, but this portion, this meltdown may last up to an hour, hour plus. I have had myself with my family and my children. We've had hour, hour and a half, hour, 40-minute, 2-hour long meltdowns. We have to be patient. We have to understand that it may take a significant portion of time for them to recover from this meltdown. Okay. Once we start to come out of the meltdown and we kind of go into the recovery stage, and the recovery stage, they may not even recall what happened. Okay. And during this explosive loss of behavior control in the rage stage, they could be biting, kicking, hitting, property destruction. When it's all said and done in this recovery stage, they may not even recall what had just happened. Okay. And when we get to this point, empathy and support is critical. Keep utilizing our de-escalation techniques, letting them know that they're okay, calming our demeanor so that they are able to calm as well. Okay. And these are the critical stages of it. But again, I talk about it. We're not getting called as law enforcement in this pre-meltdown critical stage. We're getting called on in that full-blown rage stage. And now we need to understand of how we get through that stage to get to this recovery stage. Okay. And here are some calming strategies. Okay. And the biggest thing we have to understand is we want to ignore problem behavior. Okay. And here's the thing. If we acknowledge the negative behavior, by yelling, screaming, or acknowledging it whatsoever, well, ultimately what we're doing is reinforcing it and allowing the behavior to continue. Ignoring the problem behavior, no matter how severe, will not give that reinforcement that they are looking for, and not reinforce that behavior either positively and or negatively. So ignoring it is a critical component of during these meltdowns, is knowing that behavior. It sounds very difficult because we may be in a situation that we cannot ignore it. And I understand that, but if we have the ability to ignore the behavior, ignore it. Avoid words that act as triggers. And those words are no, stop, not now. So rather than saying we have a meltdown situation and the individual's hitting, it's trying to say stop hitting, we can use a term like, let's use quiet hands, let's use nice hands, a little more positive, okay? But no, stop, not now are triggers that can lead to further escalation of the behavior. So we want to come back with positive strategies. Let's use nice hands. Let's calm our body. Okay, things like that. Okay, it's important to create a calm area. Now, if you're in a residence, a family may already have an area that is kind of a calming residence. But if we don't have that, it's our job as law enforcement to create that area. And that would be by managing our backup, turning down our radio, limiting the individuals having contact or communication with this individual, creating this calm area we can do. And it may be as simple as removing them from the environment to create this calm area, meaning if they are in a sensory overload situation outside of their home, can we bring them in an area that's calm, or remove the stimulation from them, meaning if they're in a crowded area, we clear a room. And this is critical for our school resource officers that may be listening this morning with school resource officers. If you have a meltdown inside of a classroom, if you cannot move the student out of the classroom, move the classroom away from the student, meaning clear the classroom and give it time, okay? Create that calm area. We have that ability to do that. Preferred sensory activities is another great calming strategy. And this could be through fidgets. It could be through deep pressure, which we'll talk about in a second, a little bit more. It could be through other activities. And one of the tools that we've incorporated within my department is we carry sensory kits, specifically for children and adults with intellectual developmental disabilities or autism. They have some items in there that, through my personal experience and the individual that I helped put the kids together, through our own personal experiences, we use these resources and these items to because of our own experiences. So there's chew tubes, there are a whiteboard for communication, there are certain things. Having these kits should be part of our everyday camera equipment because we can use these kits to de-escalate certain situations. It is critical that we have these kits. Very few departments have them. We're starting to see more and more departments incorporating them. And I will tell you, we had a call just about 6 weeks ago, young man, 13 years old with autism, was pretty escalated. And what do? We broke out the kit and we immediately built this rapport. He sat down with us, he began to communicate. The biggest thing with it is he wanted the whole kit. So what do? We gave it to him. We didn't ask for it back. You worked so hard to de-escalate him, and then to take away the thing that de-escalated him, at that point, you got to just give it to him. And that's exactly what we did. The kits that we are carrying in my department, we have a weighted lap pad. Deep pressure and weighted items are a great way to de-escalate an individual in a meltdown situation. Deep pressure is a very calming thing. If you have weighted items, whether it's a weighted blanket, a weighted lap pad, they can play a significant role in de-escalating a situation a lot quicker. Our lap pads are only about 2 by 2. They don't take up a lot of space. We have them in a drawstring bag in our squad cars. A great resource to have. Another great tool is calming breathing exercises. When we talk about tactical breathing in our profession as law enforcement, there's kind of a tactical breathing for autism as well. So one of the strategies that we use is smell the birthday cake. So take a deep breath in, blow out the candle. So in through the nose, out through the mouth. Smell the birthday cake, blow out the candle. That breathing, those deep breaths, we know are calming. Okay? We do it with our own selves, right? Tactical breathing we talk about. No different with an individual or an adult with autism. We know that taking deep breaths is a calming strategy. Just the terminology, how we do it. Personally with my sons, this is what we use. Smell the birthday cake, blow out the candle. Communication difficulties. So we know that a significant portion of the autism population, about 40%, has an absence or delay in language, okay? They utilize stereotyped or repetitive use of language, and it's the scripting that we talked about, where they begin to recite certain things from movies or books or preferred activities. There's a difficulty in maintaining a conversation. That reciprocal conversation that we have socially is very difficult. You may get only one-word answers. You may get no answers during the interaction, okay? Deficits in tone of voice. It is said that people with autism have a monotone voice that almost sounds robotic or computer-like type voice, okay? And then we know there's obviously this lack of social play because it's difficult to interact with people. Some of the strategies are some of the things that are affected with communication with autism, okay? Here are some language strategies and communication strategies that we can utilize as law enforcement. And the biggest thing is speaking clearly and concisely. Next, speak in a calm and quiet voice. And I will say this as we progress through the rest of this presentation is calm brings calm. Meaning that if we're calm and we model our behavior, they in turn will model our behavior as well. One command at a time. And we are notoriously horrible like this as law enforcement. Because what do? We bark 1,000 commands at somebody. Hey, what's your name? Where are you going? Where's your ID? Where are you coming from? They're still on, what are you doing? And we're 5, 6 questions into the road. One command at a time, okay? Checking for understanding it, whether they understand what you just asked them. The way to do this is have them recite back what you said. I just asked you if you know where your address is. Can you tell me where your address is? What did I just ask you? You want to know where I live. Okay, now we're checking for understanding to make sure that they understand what we're asking. No slang or abstract language. We know that people with autism are very concrete thinkers. They don't do really well with slang or abstract language. So you may walk up to them and be like, hey, I need you to take a seat. Well, guess what they're going to do? They're going to pick up a chair and try to walk away with it. Okay? Say, I need you to sit in that chair right there. Very clear, very concise. Okay? Give some extra time for responses. So you may ask them, what's your name? And you may get this awkward 10 to 15-second silence. And you're sitting there and be like, this is very awkward. Why? What are they trying to hold back? What are they trying to come up with an answer? It's not. They're just trying to process what we ask them. So give that extra time. You may not get the immediate response that you want. Okay. If you have to, repeat the phrase or rephrase it. Okay. And obviously we know one person talk at a time. And again, we are notoriously horrible like this as cops, because what do? I'm shouting orders. My backup shouting orders. My supervisor's shouting orders. Okay. Well, we don't want to do that. One designated person does the communication with the individual. They build that trust. They build that rapport. If they can, they build that conversation if they can. Okay. Preferably you have it in one of these situations. If you have a CRT officer, that would probably be the officer that I would choose to have doing the interactions. Okay. Part of communication deficits with autism is echolalia. And echolalia is this. If I walk up to an individual who has autism and I say, what's your name? And they say, what's your name? And I'm like, where do you live? Where do you live? Where are you coming from? Where are you coming from? What happens is you start to say this frustration, like, why are you being uncooperative? What are you trying to hide? Well, it's not the case. And sometimes with autism is they will repeat the last choice they have. Okay. It's not that they don't want to interact. They do. And in essence, that is their way to be able to communicate. They just don't have the words to do it or the vocabulary to do it. A lot of times, sometimes echolalia is just buying themselves more time to formulate a phrase or an answer that they've just been asked. If you're interacting with somebody with autism and you have this echolalia where you're going back and forth, or they're just repeating what you are asking of them, then what you need to do is you need to change gears a little bit. You need to switch gears and look for an alternative. You need to look for an alternative form of communication, which we'll cover in a second. Okay. So alternative forms of communication, and a lot of these things are very foreign to us as law enforcement, but they're not to children and adults with autism. Okay. One of these things, it's a very low-tech assistive communication device, and they're called PEX cards. And PEX cards are picture exchange communication system. So what I did is my time as a school resource officer in our school district is I went to our school district and said, I want to design a set of PEX cards that are appropriate for interactions with law enforcement. And these are the cards that we designed. Come with me. Are you okay? I'm here to help. I'm a police officer. Kind of stating it's obvious things, but they may not recognize our authority in uniform or the badge. So these cards are very beneficial. They're foreign to us because we don't really utilize them. But I will tell you, the visuals are a great way to establish communication with somebody who can't communicate. These cards are available all over. A lot of places sell them. Please do not buy them. I have sent out over 500 sets of these cards all over the country. I will happily give these cards out at no cost. My contact information will be at the end of this presentation. Please feel free to reach out to me and I will send them to you at no cost. These are part of our everyday carry equipment. I carry a set with me in my duty bag in my squad car. We utilize on numerous calls for service, not just with autism, to help establish communication. These kids who have difficulty with communication, these cards are not foreign to them at all. And they're utilized by a lot of our school districts. So when I was there, I'm like, why wouldn't we use them as law enforcement? So that's how we designed them. Some kids or adults with autism may have an iPad to assist with communication. And for some of us that are old enough, listening to this presentation this morning, know what a speak and spell was. You type in what you're trying to say and it repeats it back for you. In essence, the device is communicating for the individual. Okay. Picture or visuals are a great thing too. Social stories, which I'll show you some examples of in a second, but social stories are great. Visuals are a great way to establish communication. And there's a language strategy approach called first then. And this is how first then works. So if we had an interaction with somebody awesome, you would say, Jake, I need you first, we're going to stand up, then we're going to walk to my car. Okay, very clear, concise commands, one command at a time, very clear cut. We're going to do this first, and then we're going to do this. Okay. So phrases first, then, and then praise. After they've accomplished what you've asked them to do, first by standing up, then by walking to your car, verbal praise. Jake, great job listening to me. Great job standing up. Great job walking to my car. Verbal praise, even in adults with autism, will go a long way. And they are happy to try to accommodate if they can. Okay. We talked about social stories, and social stories are a great way to build reference of how to interact with law enforcement. It's a great website that I found. It's paautism.org, and they have an entire list of social stories that are free resource. They are tremendous, and there are social stories for when to call 911, how to interact with a traffic stop, in a correctional setting, in a court setting. Every scenario you could think of would be possible is available through this website at no cost. We have incorporated social stories a lot into our CIT program and interacting with children and adults with disabilities because it gives them visuals of understanding what's going to happen. Again, they are a free resource. I urge departments to take advantage of them because they cost you nothing, and they are a useful tool in assisting with communication. Again, anything from explaining what the coronavirus is, to wearing a mask, to social interaction. If you have victims in your crimes or investigations that have a disability, they're a great way to build rapport. There are social stories for understanding sexual abuse or being the victim of a crime, what's good touching and bad touching. Again, tremendous resources, again, free, and I urge departments to take advantage of them if there are. Okay, so we've talked about all this so far this afternoon, in this presentation, but really the question is, why is this a police concern? Why are we talking about autism? And I will tell you, in a short span, I pulled some articles that are up on the screen. All these articles up here are only about 5 weeks old. So this is our interaction with autism as law enforcement throughout the country, just in the past 5 weeks. Okay. And if you're saying to yourself, well, we've never had contact with anybody with autism, you probably already have. You probably just don't realize that you did. And that's the important key, is understanding it, recognizing it, knowing what you're dealing with. So just some of the things we've had. Police find teen with autism after missing Seaside Heights. Worcester police officers handcuffed 10-year-old with autism, fracturing his arm, a lawsuit alleges. 7-year-old handcuffed by a school resource officer. 7-year-old handcuffed by a school resource officer, pinned to the ground. We just had the incident in Salt Lake City where a 13-year-old boy was shot by Salt Lake City police who had autism. 7-year-old boy found safe in Moss Point on Tuesday. So wandering events, all these behaviors and things like that are all things that are going to trigger us and trigger the responses. It is our job to understand the characteristics and how to de-escalate so that we don't become the next headline in our department. We don't become the next YouTube sensation. We don't become the next media buzz. We have the ability, and a lot of these interactions can go a lot more, much better with a little bit of training and a little bit of understanding, which is why we're talking about this today. Okay. Again, going into this, why is this a police concern? Because truthfully, adults and children with autism are 7 times more likely to attract the attention of the police. They're more likely to be victimized, and they have this increased sense of personal danger, meaning they may walk into water without the ability to swim. It's understanding consequences that we discussed before. There's an alternate sense of personal modesty. If they are hot, if they are uncomfortable, they may just strip off their clothes in public because they don't have that sense of personal modesty. A lot of adults, especially severe adults with autism, have somebody to assist them with their daily living skills. So it's not uncommon for them to undress or need the assistance to get dressed by another individual. And then obviously we know our unusual behaviors, that restrictive and repetitive behaviors that we talked about, stimming can draw the attention of a passerby and or us as law enforcement. Those unusual behaviors are part of that autism diagnosis and are a common characteristic. The 2 most common calls that we're going to receive as law enforcement are for self-stimulating and or aggressive behaviors towards others. And the second is going to be a rondering or a running event or elopement event. Just in my experience, in 20 years of doing this, these seem to be the 2 most common. There are other situations where you may have them interaction with people with autism, but these are going to be the most common ones you got. In our department, in my department, most of ours, my experience, are these 2 exact things. Okay. And we'll talk about breaking them down in a second. Okay. Again, we talked about the victimization of children with disabilities and adults with disabilities. And here's the difficulty. There's not a lot of concrete numbers on this. So in 2015, the ARC revealed that 35% of individuals with special needs, specifically autism, have been the victim of a crime. So we're saying 17% have been a victim of physical abuse, about 21% sexual abuse, about 9% property crimes, neglect, things like that. Here's the other situation, is these numbers are probably very underreported, because here's the thing, a child or an adult with autism who lacks verbal skills may not have the ability to disclose that they were a victim of a crime. So these numbers are probably very, very low. There are not a lot of statistics out there. Why? They're just not. And again, going back to the point that these probably statistics are very low because they're underreported. Okay. Realities for children with disabilities. This is in adults as well. So privacy and sense of their own body is kind of diminished because they need daily living skills assistance, whether it's bathing, getting dressed, toiletries, things like that. They are going to need assistance. So it's not uncommon for them to have an individual assisting with some personal daily living skills. There's this expectation of their life achievement because of their disability. There's not a lot. There is always this kind of individual that they won't amount to much in their life. Okay, they're very obedient and passive because they rely on the assistance of an adult or caregiver so much they become very obedient and passive. Okay, we know there's a history of maladaptive behavior, and especially with children, what happens when we know when they are a victim of abuse is their behaviors start to change. The problem is with a child with disabilities, there's always been this maladaptive behavior. So it's a little bit harder to disclose or see the changes in their behavior because it's always been there. And the last part is social isolation, because they have the lack of ability to form relationships or have communication. They're socially isolated. So what happens is they become kind of cut off from the rest of the world so that nobody would really find out that they were being victimized. Things to consider when we have these calls for service, especially with somebody with autism, is we have to look to the point that they may be a victim of a crime as well. Okay. Susceptibility and victimization. So we have that perceived vulnerability because of the disability. Deficits in expressive communication. Again, very easy to be a victim of a crime if you cannot disclose that you are being a victim. And there's this deficits in detecting deception. And this is people with autism, like I said, are very concrete thinkers. So they kind of say what you say is what you say. It's very difficult to understand that they're being deceived or lied to because of that. So they're very easily manipulated. So we have to be conscious of that when we're having these interactions. Okay. Autism and age. And as individuals get older, the attitudes towards their disability start to change a little bit. Okay. So hitting as a juvenile or a child, as they become an adult, becomes a battery or an assault. Playing in parks now becomes pedophilia. Pocketing of preferred items now becomes a theft. Invasion of personal space may now become stalking. Okay, you may get that call where you go to one of your retail stores and there's an adult rearranging items on a shelf. Okay, we're probably going to get that call. We're going to get a call as what? A suspected retail theft. When we arrived, it's a person with autism rearranging the shelves because they could not handle that the shelves were out of order. So it's different to understand that. As it becomes adults in these disabilities, the attitude and the level of acceptance starts to change a little bit. Please be conscious of this as we start dealing with older adults with these disabilities. Okay. Some of the things that will impact our safety. So we talked about scripting and repetition. So they may repeat these lines from movies and videos. For us, we may see it as a perception of lack of attention. Sensory issues, that self-stimulating behavior, it may give us as law enforcement the appearance that they're being under the influence. Okay. Processing delay. They may not respond to these commands immediately, and that's going to give us as law enforcement the impression of appearance of lack of cooperation. Okay. Lack of eye contact, appearance of being dishonest, and again, that appearance is this lack of cooperation with us as law enforcement. Okay. Emotional regulation. They may not be able to handle a stressful situation, which we know and discussed may lead to a meltdown. Okay. Executive functioning. Executive functioning is the front part of our brain that helps with decision-making and organizing of thoughts. Okay. It's an area of the brain that is severely affected by autism. So they may have difficulty in organizing their thoughts, which may lead to poor impulse control. And then obviously the misreading of social cues. We don't really understand sarcasm, so they may not understand the seriousness of a given situation. And again, we're going back to that lack of understanding of consequences. Okay. A person with autism may or may not respond to their name. Okay, it's critical when we have these calls for service. If we have a caregiver or family member present, will they respond to their name? Okay, we know they have this impaired sense of danger, and I talked about it where they may go into a body of water without the ability to swim. They may walk into traffic without the concept that it's not safe because cars are coming through. They may walk along train tracks because they like trains, but they don't have the wherewithal to know that that is not a safe situation. Okay. Again, they may be drawn to water, and this is a key factor when investigating wandering or elopement events. Okay. They may or may not, depending on the situation, have a heightened fight or flight response. A lot of times this happens with first touch. Or those touching we talked about, that may trigger a fight or flight response. They may try to touch our badge, our cuffs, our uniform, because in essence, it's shiny, it's kind of interesting. They don't know that it's not appropriate, okay? It is up to you as the officer of what your comfort level is and allowing them to do that. Just be conscious of that. Some of the do's that we want to do as law enforcement, okay? Maintain our officer safety and maintain our distance. I'm also a use of force instructor, and I tell my officers all the time, we want to give ourselves time and distance. No different in these situations. Giving ourselves time and distance allow us more time to make better decisions, keeps us safer, keeps the individual safer. So utilize those. I'm not telling you to put your safety at risk. Our ultimate job every day is to go home at night, okay? Look for autism identifiers, and this could be through bracelets, shirts, tags, whatever it is. Look for them if we have those. A lot of parents are starting to mark their houses and cars with identifiers saying, I have a child with autism. Please understand. Could be seatbelt covers, which I'll show you more in a second. If not, ask them. A lot of people or adults with autism can disclose that they have this disability, okay? Brief, clear little commands. We talked about first, then praise, and utilizing visuals if we have them. Maintaining a calm, quiet voice, our demeanor. Remember what I said, calm brings calm. If we have a calm demeanor, guess what happens? We will ultimately, they will model our language. Model your body language. Again, if we're calm, cool, and collected during this, you will start to de-escalate them. If we have to touch them for a given situation, meaning they're in a situation that's not safe, and you're going to touch them, ask them, I have to touch your arm. We have to move. Can I touch your arm? Let them respond to us. And then obviously we're going to reduce our overstimulation. That is managing our backup, turning down our radio. We want lights and sirens, turning that thing off, reducing environmental stimulation. If the parents or caregivers are part of the issue, ask the parents to remove. Can you remove them from the environment, or can you move the environment from them? Some of the things not to do. We don't want to stop that repetitive or stimming behavior. We talked about stimming is self-stimulation. They are utilizing their strategies to try to calm their own body. We want that, so allow that to happen, okay? Don't take their preferred items. If their preferred item is a toy, a piece of string, whatever it is, great, let them have it. It ultimately will go further in de-escalating your situation. If their preferred item is a chainsaw, which is very possible because children, I've met several children and adults with autism who have a significant interest in power tools. We might want to reconsider that one and understand that. Don't give too many commands. We talked about clear, concise commands, one command at a time. Please take that to heart, okay? Cops, we are the worst. Bark commands all the time. Don't do that, okay? Don't interpret their silence or failure to respond as a non-compliance, okay? They may not respond to you, but they're probably hearing what you're saying. Give them that extra time. Don't escalate it. We as cops are the most impatient human beings on the face of the planet. And what will we do? We'll bark commands and we'll demand an immediate response. Well, in these situations, you may not get it. So please take your time. Okay. Wandering and elopement. And this is our second call that we're probably most commonly going to receive. And about 50% of the autism population will wander from a safe environment. Okay. Accidental drowning accounts for about 91% of the lethal outcomes in wandering events with autism in children. Okay. Other dangers are dehydration, heat stroke, hypothermia, and encounters with strangers. Okay. I will tell you this, water is in the number one spot. If you got nothing out of this presentation today, you have a wandering elopement event with autism, you check your bodies of water first. You send every resource you have to every body of water that's in within walking distance, and you check those first. There are three types of wandering. There's a goal-directed, meaning they are looking for something. They want something. It's important to talk to the caregiver, loved ones, family to understand what that is. This could be critical in how we locate them. Next one is bolting or fleeing. This is sensory related, meaning they are overstimulated from a certain situation. And they are trying to escape that situation. This is my youngest son. He's overstimulated, and what he does is he tries to run to get away from that situation. And the last one is just wandering, and this is my middle son. And if I left him unattended, he would just walk with no agenda, no purpose, just go and not realize where he was. He's done it to us on several occasions. Either way, it's critical to understand what led up to the wandering event, because it'll be critical in letting us understand where to search and how to search and where we're going. Okay. Treat all these incidents as critical. Time is of the essence. Okay. So interview the parent and caregiver. Understand what happened. A lot of times during a wandering event, there is some trigger, or what they call a derailing event, something that occurs that sends them off on this event. Okay. Ask the parent what it is. Ask about a tracking device. Many families with children with autism have GPS tracking devices for their children for this exact reason. Ask. Again, I'm going to say it again, search your bodies of water first. Okay. Other dangers are roads, train tracks, construction sites. Ask about their likes and dislikes. This is key, because if you're going to utilize a dog to assist with the search, be careful, because some kids with autism are terrified of dogs. So ask the caregiver, are you okay with that? Ask whether they will respond to their name. If you call out to them, will they respond if you call out to them? Getting the information out to the public, reverse 911, social media, missing and danger alerts within your respective states. Get that out as quickly as you possibly can. Okay. And the last thing is, don't give up. These kids are incredibly resilient, and sometimes they've been found days after the initial event. We'll say, here's the thing, they will probably hide in a given situation. So you're not just going to drive around and look. You have to get out on foot. You have to look for confined spaces, confined areas, because they will go in there for comfort. So remember that. Don't give up. They're super resilient. Again, that hyper or hyposensitivity to pain is great, because guess what? They're not going to experience pain and injuries the same way we would as a neurotypical person. So they will last a lot longer out in these environments because of that. That's a good thing. So don't give up. All these issues with tracking devices and things like that are great, but the number one reason these events are solved are through us as first responders. So utilizing our resources, knowing where to search, interviewing the caregiver, understanding the dynamics of what led up to this event are critical. And we are the number one way that we resolve these wandering events. So please take heart of the things we just talked about and how to resolve these issues. You will have these incidents. It's just a matter of time, if you haven't already had experience them in your department. I always like coordinating with other departments to see how they handle certain situations. It's great to share resources and ideas, because you may have an idea that I haven't thought of yet. Please share your elopement events with me if you have them, and what strategies worked and what things you did. And I will happily share them with other agencies as I keep training about autism. Okay. I will give you a brief synopsis of this case. This young man, his name was Danny. Danny was 13 years old, and he resided in our town. And Danny was nonverbal. He had a severe form of autism. He does have a severe form of autism. He's 14 now, almost 15. And what Danny liked to do is he would like to run from his junior high over to his old elementary school. But then it carried over. We hit in the summer months, and Danny didn't have school. So Danny started bolting from his house on a regular basis. If his mom gave him a narrow window, Danny was out the door. Mom was only Spanish speaking, so there was already a barrier in her nervousness to contact us for assistance. We worked with our school district to put some safety plans in place for Danny. And we had Danny a couple times wandering, and we got him registered in our special needs registry. We had him one night, and he went. I was able to deploy our resources to say, I know where Danny's going. Danny's probably going to elementary school. And sure enough, as I sent officers there, Danny was already standing at the front door. But why? Because I knew Danny's tendencies. I knew where Danny would go. And this is what's key within our departments, is getting to know your special needs community, building a rapport. What we did is we reached out to Ring doorbells. We explained to them what we had, and Ring donated a whole Ring doorbell camera system for the family, so that we at least had an idea of when Danny left, what direction, what he was wearing, things like that. It's been a really great tool. We've continued to work with Danny's family to try to get through these wandering events with him. We had a lot of success, but again, if you have these wandering events, please meet with your families, create a safety plan, and try to do something to keep in place. Okay. For the last part of this, we're going to talk about our interactions as law enforcement. This may come into interviews. So with interviews, it can be a little bit difficult with an individual who has a lack of communication, but remember, positive reinforcement versus being confrontational. Find some interest in hobby or activity that the person has, use as a motivator. And I talked about it, creating that hook. That's what we want. We're going to bring that in. Many children with disabilities see us as authority figures. So if we utilize some of the strategies that we utilize during interviews, like saying, well, we're going to pull video and you might be on that video, and I think that's what we're going to find. Their mindset is, well, the police would never lie. So if they're saying I'm on the video, then I must be on it. And in essence, we just created what? A false confession. So be careful of that. Allowing your extra time for responses, checking for understanding, your environmental considerations. And the last thing is really avoid asking what time. Time is a very difficult or abstract thing. So utilize their rigidness in their schedule to help narrow down time frames. Does it occur before or after school? After school. Before dinner or after dinner? Before dinner. Okay, well, we just narrowed it down between 3 and 4 o'clock. Use the rigidity of their schedules to help establish timelines. Interviewing challenges, again, Miranda is going to be difficult because Miranda's a little abstract, right? This is another great free resource from Autism FYI. It's a free app. And they've broken down Miranda into a much simpler form, again, allowing you to be able to interview somebody with autism or disability that may be a suspect in a crime. Again, this is a great way to utilize Miranda. Again, another free resource that's out there for law enforcement. Okay. Searches, if you're going to search a person with it, provide adequate warning. We talked about letting them know about touch. And then disrupting a property or moving things around is that breaking their routine. So you may have to give some verbal direction saying, hey, I am going to remove the things from your pockets. I will put them back, but we're going to have to do this. The rules say I have to go through your pockets. Okay, creating that a little bit of understanding. Okay. Use of force issues. Again, they may not understand our commands, stay at the same level. Remember, your touch may trigger a fight or flight response. We should probably consider geographic containment versus a physical force issue. If you contain them environmentally, great. If you can't, understand. Avoiding that chest down restraint we talked about, positional asphyxia. Beware of your seizures. We talked about 40% of the population with seizures. With that severe adrenaline dump during a use of force incident, what will happen? You may trigger a seizure. Pain compliance techniques may be ineffective, which we talked about that. Understanding of consequences, they may not understand or care what a weapon can do. So when you display it, you're not going to get the same response that you would from a neurotypical person. OC will probably fail to gain compliance. It will probably just create more of a more of a sensory overload, and you're probably going to just escalate the behavior even worse. If you're going to utilize a taser, please use it as a probe deployment as opposed to a drive stun. We know drive stuns are pain compliance. We know that's probably the most effective. If with baton strikes, again, just check for an increase in injury because of that low muscle tone. The baton strike may cause more of an injury than it would on a neurotypical person. Okay. Some programs that we've utilized within the department. So we partner with Medical Alert. They have a program called LEAP. It's a law enforcement agency portal. It's a great free program that departments can get into. And when you enroll your special needs citizens in your program, they're provided with a free Medical Alert bracelet and shoe tag. It's a unique ID number. And if you have them, as a first responder located, you can call Medical Alert, give them that ID number, and they'll identify the individual for you. Great way to assist with somebody who's maybe not verbal and wanders. Autism information cards. And these are being put out a lot lately by departments, and it's a way for the individual to disclose their disability, name, address, parent, caregiver, what their disability is without actually having to say it. They're a great way to do it. For us in Illinois, it's called Premise Alert, but it's basically a special needs registry. If you have the ability to register your special needs residents in your communities, please do it. Having information ahead of getting these calls for service are great. And the more information we have as law enforcement, the more we're able to better handle these situations. My county and where I live in Illinois, we utilize Smart 11. In essence, it's a lot like a special needs registry, but it registers cell phones, cars, things like that throughout the county. Again, great resources. The last resource that we started using is with our special needs registry. Big hiccup was, how do we access that information while we're on the street? How do we actually, on a call for service, pull up our information and identify this individual? So we use Power DMS in our department. And what we did is we actually implemented all of our special needs registrants into the Power DMS app. So now all of my officers have access and be able to pull up pictures and their information, demographic information right on the street. The first time we had Danny when he wandered, we utilized this to be able to identify Danny and get him reunited with his family. You may have different things, but Power DMS and their app worked for us to be able to get that information to our officers. Additional resources, so we talked about sensory kits. We've utilized the sensory kits. We have a handful of them out on the street on a regular basis, and then our fire department carries one in each of their 6 ambulances within our community. We utilize them on a call. They're a great resource. I'll give you some contact information in a second about how you can worry about getting, if you're interested in resource kits, please let me know. Window clings and these seatbelt covers, again, giving us law enforcement information before we handle some situation. We hand out the window clings to our families, their houses and their cars, so that we have an idea of what we're dealing with. Seatbelt covers, if we had an incident where there's a traffic crash and a caregiver or parent is incapacitated, how do we know what we're dealing with? Well, here's a way around it with the seatbelt covers. Again, resources that we try to provide to our families at no cost. First responder sensory kits. I'm working with another individual to get sensory kits out to law enforcement and first responders at no cost. This is the website. We're looking at doing it. The kits have a weighted blanket, dry erase board, noise canceling headphones, and different fidgets that we utilize together to put these kits together to be able, through our own experiences of things that worked, to be able to get these out to first responders. Again, the website is there, my contact information on there, and then Courtney, who I'm partnering with to get these kits out, her contact information is in there. Again, our goal is to get these kits out at no cost. So we are looking for sponsors that will sponsor the kits, but for law enforcement agencies, we're trying to get them out at no cost. If there is interest, please get a hold of us. Okay. The last thing we try to do is we try to host a special needs event. So for us in my community, we have an adaptive soccer program in my town. That letter I showed you at the very beginning of this, that author of that email is the individual who runs the special needs program, soccer in our community. I got hooked up with the program. I've been coaching for now 6 years. My sons actually play in the soccer league, but every year we have a first responder game where our officers in our fire department come in and they are the buddies with our kids. Our kids have a wide variety of disabilities. And what it does is it gives us the ability, our kids and our families, to interact with our officers, and it gives our officers a chance to interact with these kids and start to build that relationship, build on some of those barriers and what it is, and give a chance for my officer to understand that don't be overwhelmed by the disability. These kids are really just kids. They just have very unique characteristics, but ultimately they're still kids. Every April we have we take part in the Patch Challenge that's created by Detective Chris Greco of the New Rochelle Police Department. So every April we have on our squad cars, our Autism Awareness Magnets. We want our community to understand that we are, understand their children's disabilities and things like that, and we want to work with the community. So it's our supporting the autism community within our own towns. Kind of in closing, by adopting this proactive approach to educating law enforcement about autism, police departments can enhance their public safety, and this is critical. By doing this, we can reduce their exposure to liability by recognizing the signs and the behaviors of autism and responding accordingly. Practicing tolerance, patience, and following procedures that ensure the safety of cooperation with the person with autism and within our departments. Okay, this is critical. We have to be able to take this proactive approach. I leave you with this. 1 in 54 children have autism. 2 of them are mine. I do this because these are my kids. These are my sons. Maybe not today, maybe not tomorrow, but maybe somebody listening to this today is going to have an interaction with one of my sons. And I want to make sure that you have the best ability and the best training and the best resources to be able to interact with my son safely. This should carry over to your community as well. But again, for me, this is very personal. I thank you all for your time. My contact information is here. Again, it's my work email address, my website, the website, the email for my website, and my cell phone number. Do not hesitate to not call me on my cell phone. I do work midnights, so don't be afraid if a 2 a.m. response from an email, because that's midday for me. But please, if you want interested in any of the resources that I've had or more information, please do not hesitate to reach out to me. All the resources that I showed you today are free, and I am happy to share any resource that I have with any department that reaches out. So I thank you for your time. Stay safe. And again, build that relationship with your special needs community. And I thank you all for your time. Thank you.